Thank you, David. And first of all, thank you so much for inviting me to talk today. It's a real pleasure. Um, I must say that Imperial College is in my blood because I started in Imperial College in 1986. It's 40 years ago. I walked into the biology department as a wide-eyed kid from the boondocks of Yorkshire, wondering what on earth I was going to do. Here I was in London at Imperial College. So 86 I did a BSc in biology and then a PhD in biology in Imperial and then a postdoc at Imperial and then went on to do a 7 year stint as an Oxford University lecturer, during which time my thoughts were starting to develop about what I was really aiming for in my career. And it was all about school health and nutrition, but how do we get that to scale? How do we get that sustainably at scale? And how does the evidence help that happen? And so I did my first postdoc was in Vietnam, in the boondocks of Hanoi, in the villages where there was 99% prevalence of intestinal worms. The reason being that they used human feces as fertilizer and then stood on it barefoot in the paddy fields. So it just constantly recycled itself. So I've had every worm under the sun, but they're easily treatable, and that was where I was coming in from. It was, how the this is 99% prevalence, and we can treat it. There is one pill per child per year, and it costs pennies, so we should be doing it. So I started off with a deworming campaign in Vietnam, but then I went on to do work with the World Bank for a while and work with Bill and Melinda Gates for a while, and then took over this organization, directing this organization called Deworm the World, which was a Davos created piece that was looking to it's one pill per child per year. It costs pennies. We can do this. Let's raise the money to do this. And so we did. And for example, in India now, there is we started in one state called Bihar state, which is one of the poorest states in the country. And we started to put together the plan to how can we use the school as a platform for delivery of these drugs, because that's how we're going to get to it. Because the health system cannot do it on its own. There's more teachers than nurses and more schools and hospitals. And most kids go to the local schools. And because this drug is so safe, we thought, well, can teachers deliver this drug? So we did some field testing, and this is the science piece of it. Can what's the safety issue? Are there any safety issues with teachers delivering the drugs? And there was none. So we went on to deworm. Well, I'll give you an example in India. The program that we started in Bihar now has over 200 million kids treated every year. And we've kind of piggybacked that onto the National School Feeding Program. So this is a non-scientific part. You feed the children, not the worms, because that's not how it works. But if you have scientifically, but if you get rid of the worms, then the kids have more chance of absorbing the meager nutrients that they get from the food that is available. And so that is now going from strength to strength, and many countries are using the model that we developed to use the school as a platform for delivery of this simple, safe intervention. And it literally costs pennies, and the governments have mainly taken this over, which was the other prime reason for my work. I only work with if a government requests us to work with them. So it's all government led. And so what I've always tried to avoid is working like as a parachute. Like we have a research project, we have funding for 3 years, we have funding for 5 years, and then we're out. And so what we've been primarily working on is developing things with the governments to see how they can use the evidence to improve their policy and improve their implementation. So it's about trying to take the evidence and putting it into action. I'm just seeing another crazy note on my phone. Can you still hear me?
Yep, we can hear you fine.
Okay, cool. And so this whole issue of scale and sustainability, using the evidence to make that happen, and using the governments as the driver of all of that, became a key thing. My big break came in about 20 years ago with a $45 million grant from Gates. And so my focus was primarily then, because of this grant, on sub-Saharan Africa, on 6 countries in sub-Saharan Africa. And it was working across the region, trying to engage the regional bodies like the African Union, all of the government leads, and one key thing that was a bit of a turning point was the then governor of this state in Nigeria called Oshun, and he wanted to. He was in London and he'd seen what we'd been doing, and he said, "Can I meet you?" And I said, "Yeah, sure." And he said, "I'm in London, East London. I live West London." He said, "How about 8 o'clock on a Sunday morning?" And I thought, "Oh God, really?" And I said, "Yeah, sure, yeah, brilliant." And so that was the start of looking at what was working in this one state because they had, and this is more school health and nutrition and school feeding and school. The deworming comes as part of the school health and nutrition package. So we were now looking to the wider platform of schools as a mechanism to deliver more simple health interventions to kids. So so I met with him and he said, "Come and see why." And he said, "Well, why did all of the other states fail? Those 13 states or 36 states in Nigeria." He said, "Why did all the others fail and mine work?" And I said, "Well, let's not have a look at why they failed. Let's have a look at what worked for you." So we did a situation analysis down in this one state. Long story short, we rolled it out and adapted it, obviously, to various other states. And within 2 years, we'd rolled it out to the whole country. And so the school feeding, the school health nutrition program had rolled out to all 36 states and the federal capital within 2 years. So they were currently they're feeding 10 million children a day. Now, the key thing about that is it is called this homegrown school feeding. And so what we mean by homegrown school feeding is it's local produce. And so we engage with local farmers, smallholder farmers, and then group them primarily through their primary aggregator. So I was learning a whole new thing that I've never understood before in my life about agriculture. And so all of the systems that go within agriculture. And I thought, okay, so school health and nutrition has health and it has education, has to work across the sectors, which is challenging itself. But now we're bringing in another sector, the agricultural sector. And also, because of the social needs, the social benefits, we're bringing in social protection. So, homegrown school feeding now includes four different sectors. So it was like a little bit of a crazy nightmare to try and, look at how those sectors could work together because each sector has its own role, responsibility, its budget items, what it can do, what it can't do. So how do we pull all the sectors together? They're all very protective of their own budgets. So what happened in a key example here is what happened in Nigeria. So because I had the link with the governor, he later became the vice president. And And from there, we were able to put it into the president's office. And currently, it's in the president's office himself. So President Tinubu is my boss. And basically, he's put all of the domestic funding for their program together. And what they're asking from Imperial College, my team, is tell me if it's working, what's going wrong. And so we developed this system because the reason that it crashed before was because it was all cash based. So there was leakage everywhere. The leakage was about, I don't know, there was at one point it was 31% and another state was 51%. The money was just disappearing. And so we developed this system called forward contracting, which made it easy for an M&E perspective, which is where I came in, to look at, because it's all on paper. So the money runs through the paper. And so at the end of the day, the farmer gets the money from the aggregator and it's all but the money runs from the government down to the state, down to the districts, down to the sub-districts, to the farmers. And so we have this perfect system now where we've got checks and balances, we can see everything. And so there was a lot of people that were very annoyed with me and didn't like this idea. And there was one meeting in London where they actually threw papers at me across the table because they were businessmen from northern Nigeria that didn't like the fact that their cash cow had gone missing. But that said, what we're finding is that this thing is really working. 10 million kids a day are being fed right now using domestic funds in Nigeria. And the president wants to move that up to 20 million, which would be about 84% coverage of the school-age kids in Nigeria. And so that's currently taking a lot of my time to actually manage that. I'm the special assistant to the president on school feeding. There's politics involved, which are not my business. So I always take the stance that here's the evidence to guide your policy, here's the evidence to guide the implementation, and here's a system that you might want to look at implementing in the States. But that's where I leave it. You know, I really try to keep out of the politics. They try to get me to interview on TV and things, and I avoid it like the plague because I just don't want to get involved in it. But that's going really well. The PCD, Partnership for Child Development, is now part of this global coalition called the School Meals Coalition, and it was started in response to COVID, because before COVID came into force, there was 388 million children being fed around the world. And then you may remember, they closed all of the schools around the world. And it had a counterfactual because it didn't stop the spread of COVID, but it threw up so many other pieces of life in general. The parents didn't like it. One, they had to look after their kids, and they were, say, working, and also the kids weren't getting fed, and this became a real key thing. Our children are not getting fed. So we did a deep dive into some of the countries and found out that, well, some in some places the only meal the child was getting was at school. And so they weren't getting fed at all. So we kind of pushed. So there's now 180 countries involved in the School Meals Coalition, and it was launched by President Macron of France, President Lula of Brazil, and President Blunt of Norway, and they launched it. Other countries at that high level joined, and we formed the Research Consortium for School Health Nutrition, which is now housed at the London School of Tropical Medicine and Hygiene. So I'm very much on the evidence into action piece, but very much on what's happening on the ground? Are kids getting fed? Are farmers being paid? Are cooks being trained? Are we making a difference in rural investments? Are we keeping the money local? So we've been running these value for money studies, which are such a political uh, hot stone, because what we're showing from Philippines to Kenya to Nigeria, several other countries that we're publishing right now, is that for every dollar you put into the school feeding program, you get $10 back. And the 10 between 10 and 30 in Nigeria, it's $13 back on calculation. Because what's happening is that the food is being procured by the government with government funds. The smallholder farmers are producing the food and then going through the supply chain through to the cooks that cook the food. They're local women that are now being paid. They never used to get paid for this. And so they just did it because the food was there and they wanted their kids fed. And so then what we've been doing is behavioral change in kids as well by trying to look at what's locally nutritious. We've got this, I'll back up a bit. We've got this menu planning tool that we developed with the African Union Research Group, the AUDA group, and the World Food Programme that looks at what nutrients you need for a balanced diet using the WHO RDA levels and look at what's locally available and then develop menus from Monday to Friday that give the kids the 70% of the RDA that we think, 30%, sorry, 30% of the RDA through a school meal. And that's what the recommended percentage is for that intake from WHO. And so what we've been doing is using this tool, but by accident we realized that the kids were actually liking this tool because it was very visual. Have little gingerbread men, and they fill up with different colors depending on which nutrients they're getting that day. So we're now using it as an educational tool. And so the kids they have these school gardens, which can be if they're handled correctly, they are an educational tool. They can be used to child labor, basically. But in the schools that we're monitoring, the kids are actually learning about the local produce and what they can eat and what was their deficit today. So it's now been developed as an educational tool for kids to understand what nutrition they need. So all of these things are ongoing. We're primarily focused on sub-Saharan Africa. The big program is in obviously Nigeria, but in Zanzibar. What happens in a small island in Zanzibar is the same process that happens in Nigeria. We're in Kenya, that's a big program, Uganda, Rwanda, South Africa, Botswana. There's so many countries that are rolling out this tool that was developed by Imperial. We have the IP rights to it, thankfully, and it's been used as a way of kind of putting a package together to monitor and provide a balanced service based on the evidence. So part of that package is the M&E, which PCD, my team, are in charge of in terms of, well, what are you looking for? We don't want any more randomized control trials. We don't want any of this. What's happening on the ground? Is this actually working or is it not? So it's more about feedback from the field. What are the challenges? How do we improve it? And so it's really, I'm kind of moving into the area of qualitative science, to be honest. It's not particularly quantitative, but we're working with a group in Sweden right now to put some AI into this system to make it easier for the planning guys in the governments to use. So we're trying to be absolutely inclusive of all partners, all governments, all the regional heads. And what I've done is it's been quite a challenge actually, just to keep my role as the technical expert on these committees. So I try not to get involved in the politics, um, and just keep my eye on the science. So, but then the science does impact on the politics, because when you tell a government that I know it's a lot of money to feed kids, and they said we can't do that every year. So I said, well, you don't need to, because if you get this right, if you get the cycle right, it will make you money. You don't have to keep investing in the school feeding program, because it will run itself. And I gave them an example of, we had a many years ago we had an RCT in Mali, and we'd done the baseline, all of this, and then the coup happened. So it was like, oh dear, well, there's our RCT gone. What do I do about that? And we decided to look at a different angle, because some of the schools that were in our trial were now in territory we couldn't go into, and we started to look at, how to understand what's the dynamics of school feeding in a war situation. And we found that the rural systems were working on their own, because the farmers were still providing to the aggregators, and the cooks were still cooking, the kids were still being fed. So even though there was chaos at the political top, this system was actually working. And the same thing we found, I was recently invited last year to Ukraine. And in Ukraine, as you can imagine, it's the first war zone I've ever been in. And there were bombs going off every night. We spent most nights in bomb shelters. But we did get out to some of the schools, and some of the schools were actually in tunnels, because they still want despite the war, what they really want to see is their kids get educated. And, history tells us that during wartime, kids don't go to school, everything ends up in chaos. But in Ukraine, it's Madame Zelensky herself that's saying, was pushing for this peace, and she's also pushing for nutrition. She's saying the kids will come to school if you feed them. We want them fed and we want them educated. And so they brought me and my team in to have a look at what was actually going on. So seeing these kids coming out of, bombed out places, and it was so cold, going down into the tunnels, into schools to learn, and how do we get the food to them? And what food? And so Ukraine, as you probably know, is like was the breadbasket of Europe. And so there was still enough food that was grown locally to be able to provide the food to the kids in the school. So in the east of the country, they were in the tunnels. In the west, in Kiev, they were still going to school, but sometimes the school, as soon as a bomb siren goes off, they go home. And so we decided, well, let's make that food a little bit flexible, because we don't know when they're going to go home. So we were looking at different methodologies, and they ended up having centralized putting big batches together for schools in ink kind of cool boxes, and keeping them there for whenever the kids wanted them, or they could be eating. And if they couldn't eat in school, they took their package home. So it's a varied, I think it's all about the context, about how you use the school as a platform for health interventions, whether that be feeding, whether that be deworming, vitamin A, chickenpox, measles injections, all of these things. And it's about working across the sectors with the government, using their own money, and just being the academics on board to help them like monitor, but also guide their policy and implementation. And I think I don't know how long I've been talking, but I think I'd like to stop there if that's okay.
Yep. Okay. Thank you. Um, thank you, Lesley. David, do you want to come back in?
Yes, just a moment. Bring my video up.
Okay, there we go.
Yeah. Okay. Well, thank you, Lesley. A very different sort of talk. You know, I'm just astonished at the numbers.
Mm.
Um, I mean, the number of children you're dealing with and the number of children you've affected. Um, how do you stay in touch with everything?
Ah, yeah, that's a good question. I'm glad it's Friday. Um,
Yeah.
we kind of just we have a very good support net. So the network is in all of these countries is amazing, and what we've tried to do is build it from the ground up. And so the programs now kind of run themselves, and obviously we have team weekly meetings, but we regularly have country meetings. So what's going on, and what's going on, what can we help with, what can we do? But I think the beauty of it is handing it over to the countries to run with it themselves. I was just reading in the paper yesterday that the Indian school-based deworming program has its National Deworming Day, and it's still using the cartoons that we developed like 20 years ago. It's pretty cool. But it just shows you that if some kind of policy and programming is based on evidence, it is sustainable and you can scale it up if you've got the right sectoral balance and the right political leadership and the commitment from that political leadership to make it happen, then it kind of runs itself, thankfully. But we always keep in touch with all of our key countries all the time. They have a
It's
they have an idea that they like to call me after church on a Sunday. And sometimes I'm in a mood to take that call, and sometimes I think, no, I'll just ignore that one. I can't be bothered. But yeah, we do keep it's like a bit of a family, really.
well, I think it's a very big family. But no, I mean, I'm amazed. I mean, clearly you need the support of the government and the sort of infrastructure of the education system. But I'm amazed it works across cultures because the countries you were mentioning went across, well, they're mainly uh, equatorial to tropical, but they're all around the globe.
Mm.
And how do you communicate with different cultures? Because food is generally associated with the local culture in some way, isn't it? I mean, the religious and other cultural aspects.
I think I've been on a long, long learning curve.
Okay.
Because I was recently in Zanzibar, and Nigeria is a bit of a challenge to work in. I'm not actually Imperial doesn't allow me insurance-wise to go up to the north, but neither do my North now we no, Nigerian colleagues. They say there's no way. It's like having a big target on your head. And so, but then you go to Zanzibar and you think, okay, this is a nice one. I'll maybe take a few days leave at the end of this one and stay for a bit. And we were wandering around the schools, and what they're eating is certainly just from the island. It's not even imported from Tanzania mainland, but it was just pigeon peas and millet. And I was saying, and they eat that every day. And they said yes. And I said, but there's cassava over there, and there's green bananas over there. And they was telling me that the export price is higher than the school price. And I said, well, that's just crazy. And then they had orange flesh sweet potato, which is very nutrient rich, but they only have that for one term because it's seasonal. And I said, well, what about storing it? So we've been looking at options to, what's the safest way to store sweet potatoes so they can have it throughout the year. And it's about talking to the farmers. And some of the meetings you sit there and they're barefoot farmers, and I'm sat there cross-legged with them. But that's where you get the information. So I think it's trying to understand what the context is, what they're dealing with, and then is there a way that we can make this better? What are you not getting? And so, in Zanzibar, we have a person working in Zanzibar, we have a person working in Kenya, we have a big team in Nigeria. So, but they all work through the ministry. So we don't have posh offices anywhere. We just beg a desk in the ministries. So then you get to know what's really going on in the ministries, as opposed to having a car with a big flashy logo on the side. We have our own cars. We obviously reimburse fuel, but we sit on a free desk in the ministries. So it's about kind of keeping contact with the ministry people and figuring out what's going on.
What about, I was thinking about the problems of fertilization with inappropriate fertilizers. Really, you've got to get to agriculture to change that. I mean, it's the farmers. Do you educate the farmers at all, or are they just the source of food? I mean,
Mm. No, as I said, it was a new area for me altogether. I didn't even know what an aggregator was a few years ago. I had to ask. And so trying to understand how all of that works and who's the man that holds the purse and how does that money go down to the local farmer. So we figured out that the local farmers have a primary big big farmer, but not a big farmer that groups all the smallholders together. And he's the main man who then links with the planning department. So what we've been doing is running some workshops through that guy to bring the smallholder farmers to let them know. And a cool thing we've been doing is everybody in Africa, everybody across the world has a mobile phone. And so what we've done is got smartphones for the aggregators. And so the aggregators have the current market prices of everything. They have the daily updates of what's going on in the markets. And that's fed back down to the smallholder farmers. But the smallholder farmers also have just the normal phones, but they're also linked to the main system. And so this whole kind of network of phone communication, even down to the farmer in the field who has a phone, is part of the whole communication network. And then they come together I think it's every 3 months, to sit together, look at what's going on, the total transparency, as far as we know, about the market, what their produce was sold for, sold to, how much of that went to the school feeding program, how much was exported, etc., etc. So, uh, it's hard to kind of keep a grip on everything, but I think the kind of the what's the word? It's decentralized. So every piece has its own bit. And then they come together at some point. That makes sense.
it's no, I mean, you're giving a picture that certainly sounds very decentralized. Um, but it's how you hold that sort of thing together. I mean, particularly in uh, societies that are at best called developing, not
Mm.
very primitive communication systems and so on, I suppose. It's
Mm.
very impressive. Um, Bill, can we turn to any questions from the
Yeah. So Martin's got a
participants?
question. So Martin, do you just want anybody else who's got a question, just raise your hand and you can unmute yourselves.
My
Martin?
one, yes, was very simply whether you'd been frustrated recently by the closure by Trump of USAID well, around the world, but particularly in Africa.
It's had a devastating effect. But in some ways, so the devastating effect, for example, 35,000 jobs were lost in Kenya because he cut the health piece. What we're seeing in health indicators is HIV management and TB and malaria management used to be the key piece that USAID held and funded. That's all gone. So the numbers of those diseases are going up. So there's lots more AIDS cases. I don't even. Mm. So, some of the more dependent countries like Kenya on USAID help uh, have really suffered. But the only positive thing that's come out of this thing is the fact that they needed to. It's like the European allies. Uh, Trump crazily did this, and they banded together, and now the European Union and the UK have a stronger relationship, a stronger power base, united power base. It's the same thing with homegrown school feeding, is that they said, well, we can't stop feeding the kids. What do we do? So they've taken much more of of the initiative in terms of, well, okay, where do we find this money? How do we do it? Where is the government coffers? And because of the value for money studies that we did, the government recognizes that this is something we can't let go. The kids are getting educated and they're getting fed. We need the next generation to be educated and fed. And so some of the money is being squeaked out of the coffers of governments because Trump slashed the cash,
Mm.
which in my mind is a good thing because then it's more on the government to keep the thing running than it is to be relying on aid.
Mm.
But that said, there has been so many casualties.
Mm. Thank you.
Mm.
Yep. Sue, go ahead, please.
Sue Harrow, yeah.
I'm quite interested. Do you have any idea about improvement in the educational attainment and the general health improvement in these children now? You know,
Yeah,
can you see a big difference, or how does it work?
it's changing. We're seeing more girls in secondary school. We're seeing more boys in secondary school. We always talk about the girls, but it's the boys as well. So during COVID, what happened was the schools closed and boys were put back into the fields and girls were married off. So we did lose a whole chunk of children through the COVID thing, but pandemic. But pulling that back now, overall, that was a huge blip. But we are seeing uh, more girls being encouraged by their families to stay in school, to go to secondary school. And we're seeing that reflected in some of the grades. So we're seeing an improvement in maths, statistical, I can't remember I don't have those figures, but a statistical significant improvement in the math scores and some in English. But it's the numeracy, and especially in the girls for some reason. Um, but yes, so we are seeing not just attendance, and the kind of access indicators are all up. There's more kids coming to school, but it's the quantitative indicators in terms of examination success that we are seeing some movement. I think that will take time. I must admit.
Mm, thank you. Hmm.
Could I ask a question about the menu planner? Because that's, as you mentioned, that was something you developed, and how, if you kind of say land in a country, how do you go about putting that in place? Because I guess local farming will produce different produce that will have different nutritional. So do you first have to do some sort of stock take,
Yeah.
and then okay. So,
We've got a team in the Republic of Congo at the moment, and it's quite a small country, but it's very diverse. So, what the menu planner allows you to do is look at the different nutrient categories that you need to make the balanced diets Monday through Friday. And then you have a look at what's growing locally, what's growing seasonally, and then try and slot that into the basic template of the menu planner. So it's not set in stone. What's set in stone is the WHO set requirements, and that's what we try to achieve with whatever is grown local. We don't usually achieve them because either food's not available or there's not enough, or it's not getting through. But that's where we aim. That's what we target. This is what you need. And one thing that came up, I was talking to this lady, this cook in Kenya, I think, and I said, what? There was an anomaly in the reporting, and she was very cagey, and she said, well, we that wasn't available at the market because and this one was too expensive. I said, okay. I said, well, that's not your fault. You've got a budget and you can't, so you substitute. I said, but you do realize, we can substitute some things for other things that have got the same nutrient balance. And her face lit up. And she's like, really? I said, yeah, well, let's work together. What is it what's the seasonal demand for this? Um, what's getting too expensive? What can't you get? And so the team worked with their team to actually figure out substitutes. And so, I think it's all working with what's actually there, what's real. And she promised me that she wouldn't fudge the data anymore. I said, please don't do that.
I guess all of that's improving the kind of literacy, the nutritional literacy in
Yeah.
the different countries. Uh, uh, has it affected kind of the habits of the children? Yeah, in any way.
Yeah, absolutely. I mean, the kids are now very aware, especially through the school gardens, they're understanding things. And the, an anecdote which probably serves to answer this question. This little boy went back to his mum and she was chopping the leaves off the cassava and throwing them away. And he said, what are you doing that for? And so it's seen as poor man's food. And so this kid turned to his mum and said, don't you realize how nutritious those leaves are, mother? Oh, that was just brilliant. It's like, "Oh, okay." So I think the message, what we're aiming for is the next generation to be nutritionally aware, better educated, in better health, and you know, more knowledgeable, so they can be the game changers.
Okay, well, hopefully you can apply that into the Western countries as well. So, Derek, you had your hand up.
Yes, no, that was very interesting. I think I have a question. You mentioned how your role is technical, but of course there are a lot of political considerations. And I'm interested in sort of strategies or anecdotes and so on of when those two intersect. Particularly if it's, let's say, something to do with technology that's going to make corruption harder, or technology that's going to improve the process, but is going to have a political impact somewhere along the line. Do you have some anecdotes or strategies you've learned how to deal with those things? They seem to me like they must be really, really hard problems.
I think the key thing is to get the high level the political leadership on board, because I mentioned earlier that the big Nigerian businessmen from the north of the country literally threw papers at me across the table, and what I did was just pick up the papers and put them in a pile to the left of me and said, "And what was your question?" And so I didn't quite know what to do about that. So that what they wanted was the cash in the system, and the cash was just going to these guys and their businessmen, and their business partners were taking the cash to provide really bad food to the schools. And so they didn't like that. But having the political that the lead, and this is a presidential project, so people kind of back off a bit, because what the president says, goes. And so it's multi-sectoral, so you can get some awkward people in health saying it's our business, some people in education that say it's our business, agriculture saying why are you here? This is agriculture. And so it's all about kind of pulling them together you in a way that benefits them all. So the value for money studies have been brilliant in doing that, because what we've been trying to show is that the benefits go across all sectors. So if you do your role, we had to clearly define the roles and responsibilities of each sector and how they were going to work together and what budgets were going to be used for what. So yeah, it's incredibly complex, and it's all down to personalities. In some places, it just doesn't work, and some people just steamroller, just don't want to know. And then you're left with, just the education sector or just the health sector, or so you work with what you've got, but it's it's all about trying to make all parties realize that it's in their benefit, it's in their interest to make this work. But yeah, it's it's a challenge. It's the biggest challenge, actually.
Thank you.
If you worked, you've listed various countries. How do you actually penetrate a country in the first place? Or have you penetrated all countries, or do you work through something supranational like the UN, or is there a way in that?
So it really does depend. I mean, I think a key move forward has been this creation of the School Meals Coalition, which is led by WFP, but it's a coalition formed by the governments. So it's country led. So I think it's 156, I think, something like that. 156 countries are the leaders of this piece. They have a secretariat. The secretariat is led by WFP, who can be a pain in the backside, to be honest, sometimes. But it's about coordinating all of that through the different countries. Does that make sense?
Yes, I mean that sort of answers my question, I think. I kind of couldn't see if you do something in one country, you don't want to start all over again in the next country. So I was thinking of UN, but World Food Program is
It's UN, yeah.
It's UN.
it is actually that. But
It's the United Nations World Food Program.
yeah,
But UNICEF's involved, WHO's involved, but also cross country sharing is very valuable. We just had a team from Philippines go and visit in India, and the Philippines, multi-million kids they feed, and they were just looking at what the options were in India, and sharing those experiences. Brazil has laws about school feeding now. 30% of all food to their national school feeding program has to be local. It has to be locally sourced. And so a lot of countries are looking at what Brazil has done to try and make it not just a policy, but actually a law. Nigeria is going that route. It's actually looking to putting the policy into an actually legal position where children have a right to a meal every day, which they have in Brazil.
Okay. I think Asma, you had your hand up.
It kind of answered my question, but I wanted to know how many countries are the focus of attention and if any more countries want to contribute to this program.
So the School Meals Coalition is trying to do that. And last year there was only 98 countries. This year there's 150 or something. I can't remember the exact numbers, but it's growing. And that coalition serves, and what we've been trying to do, and PCD is a part, so there's 142 partners involved. So you've got all of these countries, but you've got all of these partners too. And some of those partners are actually like Novo Nordisk, the Norway fund, which is bigger than the Gates Fund these days, a lot of other funders. So it's kind of bringing together, it's like a coalition of people wanting to work together to fund school feeding. And so what we're trying to do is, is kind of make sure that all of the countries are supported. So if you look at any country, there will be a development partner in that country. Is that partner part of the School Meals Coalition? More than likely. So, who's on the ground that can support those countries through the government, through the School Meals Coalition, with the support of the School Meals Coalition, with the support of the partners like PCD that can come in and do a value for money study, for example, or implement or train for the menu planner. So our role is very much on the evidence, on the training, taking the evidence into the field. But there's other partners that are funders, political supporters, people who can just write documents. And so I'll give you an example. Well, USAID used to be key in Kenya, but that's gone by the by. But the German GIZ are very strong in India and the Philippines. And so they've been engaged with kind of this study tour, for example, from the Philippines to India, but also what is it that we can do better through the German government in terms of supporting these programs. So it's kind of just trying to like spread the net wide, I suppose.
Right. Well, I think I'm going to have to draw things to a close so you can go home on time. But it sounds to me as if you work most of the time. I'm incredibly impressed by the scale of your connections across the globe and the extraordinary work you're doing. I think, Lesley, it's really been, for me, a very moving experience to listen to you and to think the college is involved in such an extraordinary global activity. And very satisfying to know that. I'm very grateful to you for finding the time to give us an hour of your time to tell us about your work. And all I can say is all power to you for the future. I think it's really, really important, the work you're doing. And I'm very pleased in a very minor way to feel I know much more about it now than I did before you started. So I think we should wrap up at this point and say thank you from Friends of Imperial College to you, and maybe a round of applause from the yes, there we are.
Thank you.
Across the screen. I hope you picked those up as they went past you. Here are some more. Okay, so thank you, everybody, and thank you particularly to Dr. Lesley Drake of the School of Public Health, really telling us about a global impact that her work is having. Thank you.